1 week till Christmas, families are thinking of ways to stay healthy and get together in a troubling flu season, which has health officials concerned. We learned this week 3 Ottawa area children have died from complications related to the flu. The rate of infection detected at CHEO 44 times higher than last year. Many children have stayed home sick from school. Parents will tell you a lot of those stories. Anecdotally, Dr. Trevor Arnason is Ottawa's medical officer of health and is joining me now. So we've heard about this before, bad flu seasons, but this really scared a lot of people, I think, when public health and CHEO are coming out and saying, in fact, kids have died.
Yeah, it's been several years, I think, since we've seen a bad flu season like this, and the speed of how this hit is really unprecedented in recent history. And so, unfortunately, we're seeing a lot of serious illness all at the same time, and unfortunately, although we do see pediatric deaths, we're seeing 3 in a very short period of time, which is unusual, but not totally unexpected with flu to have deaths.
Do we know if in those cases the kids had other illness, there was other condition, or is it simply a very virulent strain of the flu?
So we don't have that information, but I think it's important for people to take the precautions necessary, no matter whether they have underlying conditions or not. That's why we have a universal flu vaccine program in Ontario. Anyone over the age of 6 months can be vaccinated. And unfortunately, anyone can get serious complications from flu, and anyone can pass away from flu complications.
We want to talk about those vaccinations, but just quickly on just how rampant it has been. And CHEO saying, you know, we need doctors to take on some urgent care cases, or people see your family doctor. I mean, how distressing is it when it gets busy like that at CHEO this early in the flu season?
Yeah, I mean, it's something that, you know, we do prepare for as a health system. Unfortunately, we don't like to see it all at the same time because it creates so many challenges, and that's why we heard the appeal go out. I think there's a lot of different pieces in the healthcare system that can help with this. I think we have, you know, pharmacists are doing vaccinations. We at Public Health are also stepping up our vaccination efforts and our messaging, and primary care providers across the region are helping by seeing people with these symptoms and directing them what to do.
Well, let's talk about whether it's ever too late to get that vaccination, because as soon as that news went out, we heard from people who were trying to make an appointment and maybe were struggling for a few days because suddenly people who hadn't bothered to get the flu vaccine were thinking about it.
Yeah, so it's definitely not too late, but the best time to get it would be immediately or right now. We're definitely seeing that that some people are able to get appointments very quickly at pharmacies or with primary care providers. Other people have run into challenges at individual places. Sometimes it's local supply issues where they just ran out of vaccine when someone comes in for an appointment or is trying to book an appointment. So it's important to try to different locations for pharmacies, because those are your primary location for most people. And also, if you're really having trouble, go to ottawapublichealth.ca, because we have a lot of information about where you can get your vaccine if you're having challenges.
Okay, excellent. And just quickly on this is one more thing for parents and families, something to be stressed about. Into the holidays generally, it's a time to be thinking about your own mental health, someone else's mental health.
So, I mean, we just want to remind people that, you know, for a lot of us, Christmas is or the other holidays are a really happy time. We see family, but there's often people who are reminded of being alone or are not feeling well, or, you know, as we talked about, there's respiratory illness going around. So just we're asking people to, you know, check on others, people who might be isolated or a little bit lonely, see how they're doing, and small gestures can make a big difference at this time of year.
Big thing at the holidays. Dr. Arnason, I hope you have a great holiday. Thanks so much for your time.
Thank you very much.